All right, let's talk about something we've all experienced. You wake up, you stumble to the mirror, and bam, one of your eyes is staring back at you, bright red. And your mind just races, right? You're thinking, what is this? Is it serious? Well, today we're going to clear all that up. We are going to break down exactly what your red eye is trying to tell you, and we're using the official guide that doctors across the Netherlands rely on.
So what's the message? Is it an infection, an allergy, or is it something where you need to call a doctor, like right now? By the time we're done here, you are going to have a super simple mental checklist to know exactly what to do. And here's our game plan. We're going to walk through this just like a doctor would, using what's called a diagnostic funnel. We'll start with the biggest, most important questions first, and then narrow it all down to the most common and usually the most harmless causes.
See, this whole process is about asking the right questions in the right order. It's a system designed to take you from that feeling of, oh no, what's wrong, to, okay, I know what this is. So let's jump in at the very top of that funnel.
Okay, first things first. This is the number one most important question you have to ask yourself right out of the gate. Was there an accident? Did something actually happen to your eye?
And the official guideline makes this step incredibly simple. Look, if the cause of your red eye is anything on the left side of your screen, a punch, a ball, a chemical splash, a tiny piece of metal from work, the advice is always the same. Go get medical help. Immediately. No debating it. But if your situation is on the right side, you just woke up with it, or it came on slowly with no obvious injury, then we can safely move on to the next step. All right, so no trauma. Great. Our next job is to scan for a very specific, very short list of what we call alarm symptoms. These are the body's warning flares that tell you it's time to pick up the phone and call your doctor.
These 4 symptoms are the absolute non-negotiables. So pay close attention because understanding these is pretty much the key to this whole thing.
So here's the deal. If you have a red eye with no injury, but you have any of these 4 symptoms, you need to call your doctor. And let's be clear, when we say pain, we're not talking about a little itchiness. We mean real, significant pain. For vision changes, we're talking about blurriness or seeing halos around lights. Photophobia isn't just, oh, the light's a bit bright. It's when light genuinely hurts your eye. And nausea? If you're feeling sick to your stomach on top of it all, that's a major red flag. Think of these as the check engine light for your eye. They could point to serious stuff like acute glaucoma or a bad inflammation, and you need a professional to take a look. Okay, so let's say there was no trauma and you have none of those 4 alarm symptoms. Well, you can take a deep breath because that is fantastic news. It means the cause of your red eye is overwhelmingly likely to be something super common, totally harmless, and it's probably going to clear up all by itself.
Now, the most common culprit by far is infectious conjunctivitis, which everyone just calls pink eye. The guidelines tell us it usually comes on pretty fast, and it's typically caused by a simple virus. Now, it's contagious and it's annoying, but the most important thing to know is that it's almost always harmless and just goes away on its own.
And this number right here? This is why we don't just rush to get antibiotics. The Dutch guidelines point out that about 3/4 of people with a standard pink eye are completely fine within a week, with no treatment at all. Your body just handles it. So in most cases, antibiotics just aren't necessary. Think of this as your quick identification guide. If it's conjunctivitis, you're looking for that all-over, general redness, usually with some sticky stuff that might even glue your eyes shut in the morning. A subconjunctival hemorrhage, that looks way scarier. It's that bright, solid patch of red. But the key is, it's totally painless, and it's usually just from a cough or a sneeze. Then there's episcleritis, which is different again. It's just one section of the white of your eye that's red, with maybe a little bit of irritation. You know, sometimes the problem isn't actually with your eyeball. It's with the stuff around it, specifically your eyelids, or just not having a good, stable tear film. And a really common cause for that is a condition called blepharitis. The absolute easiest way to think about this is like a plumbing problem in your eyelids. You've got these tiny little oil glands that get clogged up. When that happens, it messes with the quality of your tears, and that's what leads to that classic gritty, irritated, red-eyed feeling. And if you think that might be what's going on with you, here is an amazing practical tip straight from the official guidelines. The recommended self-care is this simple 3-step routine. First, you use a warm compress to melt those clogged oils. Second, you gently massage your eyelid edges to help get the oils out. And third, you just clean the area. It's simple, it's effective, and it actually tackles the root of the problem. So, if we boil all of this down, if you're going to remember just one thing from all of this, let it be this next point.
At the end of the day, for any red eye that wasn't caused by an injury, it all comes down to those 4 alarm symptoms. Are they there or are they not? Your entire decision, whether to just relax and wait it out or to pick up the phone, it all hinges on that one question. That really is the core principle of the whole guide. So the next time you or someone you know wakes up with a red eye, you're not going to panic. You're equipped. You have this simple, powerful framework. You know the very first question to ask, was there an injury? And you know exactly what critical alarm symptoms to check for next. You've got this.